everybody. Welcome to the podcast, The Truth About Your Heart. Today my guest is the Dr. Sanjay Srivatsa, cardiologist from the Heart, Artery, Veins Clinic. What you should know before it's too late. Welcome, doctor.
Thank you. Great to be back here.
What is the most important warning sign of heart problems?
Well, I think everybody knows that when they feel chest pain or chest discomfort, as we prefer to call it, that is a feeling that you should pay attention to if it persists. This is the number one cause for visits to the emergency room where people think they're having a heart attack. Well, what exactly is it? Classical heart pain is a central or chest pressure or tightness, like a band-like squeezing that very frequently, but not always, radiates into your throat, your neck, your back, or even your arms, which can feel tingly or heavy. This can occur during moments of extreme stress or extreme activity, or in some people with even moderate activity. In some, it comes on when they exercise and relieves when they rest. In some cases, if it's mild to moderate, they can even walk through this chest pain. And it frequently just indicates, if it is chest pain due to the heart, that the heart is not getting quite enough blood flow as it needs for the exercise or the stress it's facing. In other words, it's using up more of the nutrients and oxygen than the arteries can supply. Remember, the heart doesn't act alone. It acts together with all the other body systems, including and especially your lungs. If you become short of breath walking up the stairs or doing minimal activities, pay attention to the chronicity of events, the timeline. For example, you might feel short of breath if you've not exercised for a while and you climb stairs. But if you find over days, weeks, that you can do less and less, when even simple things that used to take you no effort, like perhaps lifting a box or cleaning the floors or walking upstairs or lifting laundry suddenly makes you severely short of breath, or your heart race or chest pain, then that might be something you want to pay attention to and have investigated. One of the things no one explains is fatigue. Many of my cardiac patients will complain of fatigue. It's a hidden sign. And if you feel drained out doing everyday things like I explained, and you are getting short of breath with that fatigue or even chest pain, then all these things may indicate that you have a heart or perhaps even a lung problem or perhaps a metabolic problem. There are lots of reasons for fatigue, including anemia, thyroid problems, illness, infection. So we need to look into those things more carefully, but it can be a sign. I've already explained that heart pain sometimes is not felt in the chest. Sometimes, and in some people, it's only felt in the jaw, the neck, the back, or the arms. I've even had patients who've gone in for problems thinking they had an appendix problem or a gallstone when in fact they were having a heart attack. This is the reason when you go to the emergency room, an ECG is always done in these gray borderline cases, and blood tests are done to examine for myocardial infarction or heart attack, which are diagnostic. Now, sometimes you don't necessarily feel chest pain or shortness of breath initially. What you feel is palpitations, which is the technical word when your heart races suddenly, or if it skips or pounds, and frequently it occurs rapidly and switches off like a light switch on and off.
Many times we think then we have just palpitation because we have blood pressure problem, and it's very important to don't ignore this pain.
Frequent palpitations that come all the time and that are associated with dizziness, chest pain, shortness of breath, or a sense of fatigue that wake you up at night. These are all things that you should consult your physician about. The other thing I would point to is swollen legs. Now, swollen legs can occur for a variety of reasons, but they can be, in many instances, a sign of heart failure. In other words, the heart doesn't pump strongly enough, causing fluid buildup and backup on the legs and lungs. So there are many reasons for swelling of the legs, and heart failure is only one of them, but pay attention to that.
what's happened when we see somebody in the street? This is the myth or is the true? What part of body we need to put this in, left or right side? I know it's some position.
No, there's no necessarily any position, but if a person collapses and is unconscious, we move them into what's called a left lateral or recovery position. In this way, if they vomit or there are any secretions, it doesn't get aspirated into their lungs and drains out. That's why they are put into that position. Now, I did want to mention one other thing. If a person has dizziness or fainting, this can signal poor blood flow to the brain. It can also signal heart rhythm problems, slow or fast, or it could even signal valve problems within the heart that interrupt the proper cycle of flow. Of course, it could also indicate problems in the neck arteries transmitting blood to the brain, which can also silt up with cholesterol blockage. So pay attention to dizziness, fainting, swelling of the legs, palpitations, pain in the chest, back, arms, or neck, shortness of breath, and if you feel unusually fatigued. There are a lot of instruments now that help you diagnose some of these things, and while I am not here to sell the Apple Watch, I am here to tell you that there are many devices that can monitor your heart rate and your EKG now and are available on the market. If there is a rhythm and you're feeling palpitations, they can capture that rhythm and transmit it to a doctor.
Thank you, doctor. And from your experience, why do people ignore the heart problems and the first symptom? We are scared to go to doctor, or we just think, like everybody who now want to be more than doctor, then we provide the symptoms very well to just take some supplements.
Well, it's a combination of both denial and lack of appreciation and sometimes fear. Some people think that when they're undergoing a stressful situation and they feel these symptoms, that it's just situational stress or they're getting older. So what they do is just delay until it's perhaps sometimes too late. The other thing is, and it's quite natural, is that they do suspect that it is something that they should have examined, but they'd rather not lift up the carpet and see what's underneath. The fear of bad news makes them avoid the doctor. I understand this. Sometimes, even the symptoms are hard to understand. They can be very vague. I've talked about how vague heart pain can be, and this is particularly true in women. In women, do not experience the classical chest-clutching pain that many people speak of in the media and portray on the TV. It can be felt, as I've told you, as vague jaw pain, neck pain, back pain, or even arm pain without the chest pain. And in diabetics and older people, the same problem occurs. These symptoms are various and they are subtle or different. This is the reason why astute physicians will consider your risk factors and your probability of disease and try to investigate whether you have a heart problem. It isn't a question of saying, I think that pain sounds like it's the heart and let me check for the heart. It's a question of saying, this might be heart pain and are there risk factors which would suggest it is and therefore I should investigate it. It's a whole different way of thinking. Now, the other thing is we're all busy. So, going to the doctor, sitting around, having tests done, this all costs time and money, and people tend to put these things off. The other thing is not to look at the TV all the time, but to do your own investigation. It isn't always as it's portrayed on TV. Just as you see people in the ICU on TV with a plumb normal electrical rhythm on the monitor, we shouldn't always expect our media stereotypes to match with life.
It's true. And what test do you consider the most important, for heart disease prevention?
Well, I think there isn't a single one test. For example, you could say, why not we just check cholesterol levels? After all, that must be important. Well, then we find out that if your kidneys malfunction, you could have a higher risk of vascular or cardiac disease or heart failure. So that test becomes important. Or you could say, well, we should all have an echocardiogram to check if our heart's pumping well or our valves are working. And then there are other tests. So rather than say the most important test, I will just offer a few which you can consider for yourself. I think knowing your blood pressure is almost the most important test because it is the most basic measurable physiologic parameter that we can alter and easily. Most people blissfully disregard their blood pressure, and sometimes when they come to the doctor they notice it's higher. When they go home they notice it's lower, and so they say, well, that's situational white coat hypertension and I don't need to care about that. Well, it turns out that the same stresses apply when you're at home, when you receive bad news, when you open your electricity bill, etc. So that also cannot be dismissed, and enough of those events add up in life, just as we talked about previously when it comes to aging. So pay attention to your blood pressure, look up the guidelines. In general, you want your top level number to be the most important consideration, and in life we try to bring that down to about 130. Now, we don't do this immediately, we do it slowly and gradually and using a combination of lifestyle and medicines, etc. But pay attention to the blood pressure, pay attention to your cholesterol levels, good and bad. Pay attention to the blood fats, which are not the same as cholesterol. Those are called triglycerides. The good cholesterol is called HDL, H for heaven. The bad cholesterol is LDL, L for hell, easy to remember. And there are a few other lipid parameters that we don't need to bother about right now. However, I think it is important that you exercise. And if you can't exercise to a reasonable level for your age and limitations, orthopedic or otherwise, go to the doctor, get an ECG, have your blood pressure checked, have your heart listened to, and perhaps more advanced tests such as a stress test or an echo or blood work will be required.
When we discussion about EKG, how many times and how is important, I don't know what's the medical call, the RTG of our neck?
Yeah, well, that's actually not a röntgenogram, which is what you're talking about, or an X-ray. It is, in fact, an ultrasound. We do ultrasounds of the neck to detect carotid disease. Now, unfortunately, there's no one symptom that gives away carotid disease. Of course, if you had a stroke and we check the carotids and we find a critical blockage, we tend to try to fix that because we presume it may be important in causing the heart attack. But unfortunately, we don't always know who has significant blockages and what kind of blockages they have in the neck or even the heart arteries.
Why we just don't go one time a year or one time for 2 years and doing this RTG neck? I know many patients who have the blood clot and have the stroke or lost the vision.
Well,
why we don't prevent this?
Well, we don't operate blockages that are less than 50% that don't cause flow problems to the brain, because the brain is a very subtle organ. It in fact has 4 major arteries climbing the neck that supply it front and back. There are 2 carotid arteries at the front and 2 vertebral arteries at the back. And they meet in a little traffic roundabout called the Circle of Willis at the base of the brain. So if you shut off one of the pathways, the blood will reroute through the other. So you're protected in that sense. But just doing tests to see whether you could find something needs to have a little bit of planning around it. For example, you might have a 30 to 40% blockage, which is not critical, but still indicates that you need to modify your risk factors. If it leads to that kind of incentive to improve your risk factors, then it will have been worthwhile. You will reduce your blood pressure, reduce your cholesterol, perhaps consume an aspirin. I don't know what it is in your particular situation, but so long as the screening test actually has an effect to improve quality of life and length of life, or actually initiate some clinical decision making, then it's okay. The problem is when we do a whole bunch of tests which cost money and 90% of them are all returned without any consequential action, that society starts to ask quite rightly whether they should be done at all, and your insurance may not pay for them.
But better than we prevent from stroke disease than we doing after. Yes.
Yeah, well, there is one test. For example, if we want to talk about a test so we can discuss it, there is a screening test which is called the coronary artery calcium score. In this test, a CT scan is done. It's a 5-minute low radiation CT scan, especially of one region, the heart. What it does is it adds up all the calcium bits and bobs that it can see across all the different scans and gives you what's called a calcium score. Now, what has been shown is that the calcium score directly correlates with the amount of cholesterol plaque in your arteries. One thing everybody doesn't understand is that your heart arteries are like a donut. Now, what we're worried about when we have a heart attack or a stroke or anywhere fed by an artery is that the hole of the donut where there is space is where the blood runs. And so if the hole within the donut narrows, we have problems. Now, you could conceive of a situation where the donut grows outward and the hole remains the same. In other words, the wall of the donut where the cholesterol is deposited thickens, but the actual hole where the blood flows is unchanged. That's called remodeling. So it isn't enough to know whether you have lots of cholesterol build up in the wall. You also want to know whether it's actually causing some problem with blood flow. Now, on the other hand, the more cholesterol plaque you have, the more likelihood you are to have one or other plaque, even though it's a 20% plaque, is full of inflammation and fatty content that can rupture, causing the blood to clot and then initiating a stroke or heart attack. That's the reason why 20 to 30% blockages can kill you the same, and 90% blockages, though they can, rarely do, because they've had time to develop and the artery has healed or calcified over that period of time. But in the context of your coronary calcium score, if you have a score of 0 in the population, it indicates a very low risk of having a heart attack. Now, if it's above 0, you may need to alter your lifestyle, as we've already talked about, diet, exercise, etc. But on the other hand, if your coronary artery calcium score is very high, it may very well indicate that you have flow-limiting blockages in 1, 2, or even 3 arteries. Coronary artery calcium score is most useful in people who don't have classical symptoms. No chest pain, no shortness of breath, but are at significant risk and want to see whether their risk factors have caused them to build up plaque and to alter lifestyle accordingly. For example, a person aged 45 who has a strong family history of heart attacks in multiple relatives, who may or may not have smoked either now or in the past, who has high blood pressure and high cholesterol, but they're fully functional and have no symptoms. Now they want to know what their risk is and what should be modified. There are 2 approaches. One is to say, I'll modify everything I can physically modify and I don't need a scan. And that would be a perfectly logical thing to do. The other is to say, I really want to know where I am in this process. And I do believe that it will incentivize me to change my life around. In that case, I always order the test for the patient wherever I can.
I will be your patient. I need to come and doing the test. We know that the stress affects our brain, but tell me, doctor, how does stress affect our heart?
Stress is a profound influence on the heart. There's no question. There are some situations which are seen, especially in women, though occasionally also in men, where an extremely stressful event, an earthquake, a car accident, some tragic news, causes significant stress and a surge of hormones associated with stress, including adrenaline. And what happens is that the arteries spasm, and for a moment there is absolute loss of blood flow due to the spasm, and the heart becomes stunned and in some cases damaged. And that's called the broken heart syndrome. It's also called the Takotsubo cardiomyopathy, which means a heart attack caused by this kind of extreme stress. Now, what are they? You know, when stress occurs, often we cope with it in different ways. Well, what do we mean by that? Well, we can eat more, eat badly, we can smoke more, we can take drugs that we think will help calm us, drink more alcohol, and suffer poor sleep. And we all know all these things are bad for our heart health. But the stress itself releases cortisol and adrenaline. These are called the stress hormones. These inflame the arteries, make clots more likely, and I explained earlier in one of our earlier podcasts that chronic inflammation is one of the things that damages the body most. The body can suffer one insult, but when it suffers even a low-grade insult for a long period of time, it is bad for the body. Raising blood pressure is a constant in people who are constantly under stress, and high blood pressure is the number 1 killer in our society. We should not even hesitate to mention that, and we group that with smoking and diabetes, all of which raise our cardiac risks enormously.
The management stress is very, very important in our life. But what can each of us do today to strengthen our heart?
Well, let's just keep it very simple. Move your body every day. Learn to exercise 30 minutes of walking, cycling, dancing. Even if you can do it 3 or 4 times a week, it will be enough. It will improve your blood flow. It will control your blood pressure. It will burn your fat. It will help control even your lipids. And never mind everything else it does to improve your joint mobility and prevent joint pain or damage to your spine and back. The moment you improve your axial muscles and skeleton, build strength in your bones, all the health benefits flow. Eat better. One of the best things I can tell you to do is to cut out every single ultra-processed or processed food you can. Eat more naturally. Eat more plant food. Eat healthy fats, olive oil, avocado oil. Lean to protein. Avoid red meat like the plague. Avoid fast food like the plague. Watch out for sugar and carbohydrates. Remember, a carbohydrate is just a whole bunch of glucose molecules strung together like sausages. The more carbs you eat, the more glucose gets released. The more glucose gets released, the more stress on your pancreas. The more stress on your pancreas and the increase the weight, the greater the chance of diabetes. Avoid ultra-processed foods. There are consequences both cardiovascular and for cancer. Sleep 7 to 8 hours a night if you can. Try to get into healthy sleep habits. Exercise will help you sleep. When you sleep well, your body repairs. When you sleep well, your blood pressure lowers. When you sleep well, your metabolism improves. The stress we can't avoid, but if we can do things to divert our stress or cope with it, deep breathing, yoga, walks in the nature, time outside doing hobbies, time spent with loved ones, all of these have been proven to lower our cholesterol and adrenaline. Know your numbers because it helps at least to know where you are and whether you are improving. It can help build positive feedback loops. When you track your blood pressure, your cholesterol, your sugar, and a doctor helps you understand what you need to do to improve them, you do those things, they improve, you feel better, and you continue to do them. That's a positive feedback loop. That's what I would like you all to think about. Finally, don't be a loner if you can. Loneliness is a tragedy for all of us. It's out there and a lot of us are ignored and feel alone and miserable and depressed. And there's no question that loneliness kills. It is one of the reasons why people who have a pet often live longer when they don't have a partner. Loneliness is a major ignored risk factor, as is depression, and we should all strive to lower these for each other and for ourselves.
Oh, thank you, doctor. To come to conclusion, I would like to say that stress is not what's happened to us, but how we manage this situation. And when we understand this sentence, we manage our life. And I always come to the conclusion that our life is in our hands, and our heart, it's like my lovely donut, what I like, and now I need to go buy the donuts. You make me too hungry, doctor. Thank you today for lovely interview. I think we learned a lot, and I am glad that you reserve your time and you lecture us, you educate us, and this is the best education ever we have, and I really appreciate. Thank you.
My pleasure. Look after your heart, but more importantly, look after your soul.